Today we're talking about how to fix hip issues that you might have with Dr. Cody Grigsby.
Dr. Duberry.
All right.
And we're going to show you something simple that you can use at home. You need a partner, so you can use your wife, your husband, a kid. It's easy to do, anyone can do it. And the great thing about it, it's quite safe. But like anything, you test it first, and if you feel better, you use it. And if you don't feel better, what do, Dr. Cody?
You're gonna stop. If you're
That's
feeling
it.
some pain, especially any kind of pulling, tearing, stretching,
You stop.
we're good. We're stopping.
But most of the people will have an improvement, and the improvement is going to show. We're going to show you that very quickly. Why? With Arthur and Dr. Cody. Would you mind to explain that?
Love to. So here's Arthur. Now Arthur has a really movable SI joint, but when we say SI, we're talking sacrum is the S right here. Ilium is the bones on the outside of the pelvis right there. Now, a lot of times when people have a problem with their SI joint, it's posteriorly rotated like this. So when we're facilitating this motion, you're putting your hand over top of the sacrum, kicking the leg back, which opens up that joint just like this. And you can hopefully see, and like I said, Arthur has a good range of motion. Usually the SI joint doesn't move this much, but when you're pushing back, you're opening up that joint, and you can free up some of the nerve endings with that as well too.
Thanks, Arthur. So you're going to go on the wall, and we're going to pretend. You're a good liar? You have pain in your right side?
I do.
All right, so you're going to pretend that he has pain on the right side of his back. His sacrum is right here, and the ilium is right here. So I'm going to put my hand on the sacrum, flat hand. I'm going to get a good stance position, and I'm going to use, with my other hand, I'm going to stabilize the anterior part of the pelvis, what we call the ASIS, anterior superior iliac spine. So I stabilize it, and now I'm going to ask him to keep his knee straight and to throw his leg in extension, raising, that's it. And I'm going to keep the contact here. Go ahead, Cody, another time, another time, another time, another time. Stop, 5 times. Now I'm going to ask Cody, walk a bit. You feel better, and if you feel better, we're going to do that 3 sets of
10.
3 sets of 10, it's usually what works well.
Doesn't take a lot of time, but can have a lot of improvement if this is right for you.
So try it. Good advice from Dr. Duberry and Dr.
Cody Grigsby.
Arthur is a patient of us, an old patient of us, and when you have a low back problem, very often the hip, and it's not exactly the hip, we call that the ilium, that big flat bone that you see here, move posterior on the side where you have pain. And usually you limp a little bit with it. So what we're going to do, we're going to basically block the articulation between this big flat bone and the tailbone, that we call the sacrum, and you're going to perform a movement that brings this ilium a little bit anterior. So you're doing your own correction. And that's why it's a great technique, because it's safe. Don't you agree?
I agree, it's very safe.
So we're going to do that, and let's do it together. You want to be the patient, Dr. Coy?
I do.
Yeah, all right. Okay.